because I'm sure you want to know who is hosting today. And then we are going to have a little chat about who Acre is and youth aesthetics. We're going to talk about the products within the youth range, what hyaluronic acid is, the aging phase, and also injection techniques. And then we're going to do look at anatomical considerations as well. Oh, sorry guys, I'm just moving on to the next slide. So my name is Sabrina, as I've mentioned already, the owner of SK Aesthetics and also SK Aesthetics Academy, which is based in Birmingham. I am a nurse by background, so I've been nursing for 14 years and I've been doing aesthetics for 8 years. I'm a children's nurse by background and still do my nursing as well as run the aesthetics company. And two of my most important jobs is being a wife and a mother to 2 children. So that's a little bit about myself. I won't delve into it any further because obviously you can read it on the presentation. Oh, sorry, I'm just reading the chat there at the same time. So yes, I won't delve into it a little too much, as you can see it all in the presentation. But we started 8 years ago. We have obviously grown massively since then, becoming a training academy and also becoming affiliated with companies such as Acre Pharmacy, Youth, and other companies that you can see within the PowerPoint. So now we're going to look at who Acre is. So I'm assuming that most of you will know who Acre is, as you've all had an invite to it today. So Acre is part of the CST Pharma Group. It's been around since 2001. And it is one of the largest pharmaceutical suppliers out there. They supply to wholesalers, they supply to the NHS and also other major pharmacies as well. They also have Youth. So Youth Aesthetics is a company which is also part of the CST group, born in 2006. And Youth is a brand that's basically brought us as a company over to Acre Pharmacy. So we found Youth and found that Youth had a lot of research behind it. It's got, 18 years worth of research behind it. And with that, we felt that, brand, it was a well-trusted brand for us to use within our clinic and also Training Academy. So not many products have been researched for such a long time. So that's why we felt that we could trust the brand. Youth is a very natural product to use. It contains not only, we've got 4 different products within the range. So you've got your fine dermal filler, you've got your deep dermal filler, your sub-Q dermal filler, and also your Hydrate, which is your skin booster. So within clinic, we do use all 4 of those in clinic and also for training purposes. I will go through each different product with you towards the end, just in case you're not familiar with what we may use each one for. But the main one that we're going to be focusing on today is our skin booster, known as the Hydrate. Also, guys, if you do have any questions, please, if you could put them in the chat and then we will answer them towards the end of the presentation. So now we're going to look at what hyaluronic acid is and how it works. So I'm assuming that most of you here will know a little bit about hyaluronic acid. So this is kind of touching the surface of it, really. So Youth dermal fillers, they're made from hyaluronic acid. You may not realise it, but obviously our body is naturally made up of hyaluronic acid. And obviously as we get older, we start to lose that hyaluronic acid. But there are many benefits in the body, and there are 4 key ways of keeping the benefits of hyaluronic acid within the body. So we've got number 1, which is HA is very hydrophilic. So that basically means that it attracts water. It attracts up to 1,000 times its weight in water. So it really hydrates the skin. And we think that hyaluronic acid, as the body, it's the body's natural own moisturizer. Then we've got number 2, where hyaluronic acid helps to improve volume. So obviously within the dermal filler or within the aesthetic industry, we use dermal fillers as a hyaluronic acid to give us volume. And that could be volume within the dermis layer, where we use it for things such as cheek volume, lip volume. It could be used to correct fine lines and wrinkles, helps to improve the skin and make the skin look a little bit smoother and more youthful. Number 3, we've got the HA also stimulates the fibroblasts within the dermis to produce collagen. And this helps to give us a youthful and radiant appearance within the skin. And number 4, it is an antioxidant, which means that it can help remove the hazardous free radicals created by UV light. So we know that obviously UV light can be very have a very negative effects on the skin, which we'll move on to further on throughout the presentation. So first we're going to now look at the aging face. So we know that we age in many different ways. It presents in different parts of the face. So it presents in regards to loss of collagen, loss of fat. So we often can lose fat within the mid area, around the cheek areas. We can lose bone mass, and all of this kind of gives us the melting effect. So if you see on those images that's on the presentation, the last image towards the back, you can kind of see that one side of the cheek where it appears like the face is almost melting. And that's the effects that it gives with the aging process. There's many different factors that can affect the aging. So that could be smoking, it could be alcohol, as in excessive alcohol, poor diet, stress, depression, etc. But one of the main things, one of the main factors of aging is sun exposure. So obviously we live here in the UK, we don't get a lot of sun exposure, but we do go on holiday and then we bask in the sun and take in as much sun as we can. But what then happens is we're creating aging within the skin, and 90% of aging actually comes from sun exposure. So it's really, really important that we encourage people to wear SPF. If not our clients, you also need to make sure, if you take nothing away from today, you are wearing SPF every day. Sorry guys, I'm just trying to find the next slide. I'm not very technical, so bear with me. So with that being said, with us having so many factors that contribute to the aging process, we kind of we kind of class this as multifactorial process, because there's multiple things that impact on the aging process. And we need to obviously consider what we call ECM, which is extracellular matrix modification. So what that basically means is the importance of ECM is that it basically holds everything together. So it holds our collagen, it holds our hyaluronic acid, and it also holds our elastin. So if we don't have that ECM, we're actually losing collagen and we're losing hyaluronic acid and losing the elastin as well. So we need to make sure that we do consider that within the aging process. It's so important, obviously, the ECM, it's got an important role in regards to collagen because it helps to strengthen and it helps with the resistance. You've got the elastin, which helps with the extensibility and the stretch of the skin. And then the hyaluronic acid, which also helps with the hydration and cushioning of the skin, which keeps our skin youthful. Here we're just revisiting again the key components of the ECM. So as I've mentioned, your hyaluronic acid, this is what attracts the water. We've spoken about it being very hydrophilic already, and it also acts as an antioxidant as well. You then have collagen, which some of you will know, we have lots of different collagens within the skin. And actually 70% of the human body is made up from collagen. So it's really important that we do try to maintain our collagen as much as possible. And then we have elastin. And this allows the skin to stretch and recoil, less prevalent than collagen, but equally as important. So some of you would have seen this image. It's obviously a very common image within the aesthetic industry, which kind of shows the effects of photo aging and loss of collagen. So this is a male van driver. He's 69 years old, and this is 28 years worth of skin and driving the van without protection on the skin. So you can see on that one side, you can see that the lines and wrinkles, you can see the loss of elasticity, so the skin looks a little bit looser, and also discoloration to the area as well, where it's been affected by the UV rays. Next to that, you can see two images which shows you young skin and aged skin. So within the young skin diagram, it shows you the fibroblasts, it also shows you the collagen and the elastin. But then if you look at the next image, it shows you aged skin. So the fibroblasts become more fragmented. You can see that there's also less collagen fibers and there's also less elastin fibers. And this is how the skin would present with aging. And it could be aging from sun exposure, it could be from lack of good skincare. So it could be down to many different factors, as we mentioned already. So now we're going to look at what skin boosters are, as that's what we're here to discuss today. So skin boosters are a formulation of hyaluronic acid. It can also have other things in there, such as vitamins, minerals, and antioxidants. So focusing on our Youth Hydrate product then. So it's a subdermal moisturiser. It helps to stimulate fibroblasts to produce collagen. The products help with the tone of the skin. It's going to help with the texture of the skin, hydration, and also improve the overall skin condition. You can see the image of what it looks like there. So it comes as a pre-filled syringe in a lovely glass vial with 2 needles. It's got 24 milligrams of hyaluronic acid, a free hyaluronic acid as well per mil. It's usually indicated for skin that can be quite crepey, loose skin, obviously your aged skin. It's not something that's used for something such as pigmentation, but they're obviously for this particular treatment, for this particular brand, it would be specifically for aging skin and also for hydration. There are different ways of how you can inject the product. So obviously everybody has their preferences of how it's injected. So some people prefer to use a cannula and some people prefer to use needle. Personally, I'm a needle person rather than cannula, but some people are quite comfortable using cannula for dermal fillers as well as skin boosters. So if you're using a needle, it is injected as microboluses, and these are superficial injections. So it's really important that, which we will move on to later on throughout the presentation, but it's really important that when you are injecting with a needle, we are keeping it superficial, because the level that we want to go to within the skin, if you think of, we know that the skin has got its 3 layers. We know within our epidermis layer we have 5, and then within our dermis layer we have 2. We are aiming to get into the superficial dermis layer of the skin. So we need to make sure that we're not going too deep with the needle, and that's probably one of the only downfalls with needle technique, is that you need to ensure you are always superficial. When we are doing our microboluses technique, we are literally going to be piercing the skin and going in at kind of like a 25-degree angle. And we're going to be using a 30 gauge needle. Literally the bevel of the needle needs to go into the skin, and that's it. And that's as deep as you need to go with the injection technique. We will kind of do it as a little bit of a grid technique. So you could use a pencil and draw the grid onto the skin if you wanted to, ensuring that your markings are around about a centimetre apart from each other. You then obviously have your cannula technique. So we do recommend, if you are using a cannula, to use a 25 gauge cannula. And it's usually injected, so it's really hard to show you because obviously you guys can't see me. So I'm kind of pointing to my face as I'm doing it. But you would insert your needle at the angle of the jaw, and then you would position your cannula along the jawline, and then mid-cheek, and then a little bit higher up onto the cheek. You could deliver per side 1 mil of product. So regardless of which technique you use, you can inject up to 1 mil per side. So one of the things that we also need to consider is obviously anatomical considerations, and that's something that we need to consider within any injectable treatments. We need to make sure that patient safety comes first. So it's imperative that obviously we understand patient safety and that we ourselves become familiar with facial anatomy. So the most important thing as a practitioner is to work within your limitations and make sure that you have awareness of your competencies. So if you don't quite feel comfortable using a cannula, then use needle. If you feel, confident with using a cannula, then that's absolutely fine. But you must make sure that you always work within your limitations and know your competency levels. We don't tend to use skin boosters towards the upper part of the face. So we try to stay from the 2/3 down. So from the cheeks down, you can inject with skin boosters, this particular skin booster. However, we don't tend to inject the forehead with Youth Hydrate. If you look at the diagram that's on your presentation, you can see I can't quite, let's see if I can point it out for you, but you can see these green areas here, these green zones. So these are what we call high risk areas. So you can see this is why we wouldn't inject anywhere above the eyes with our skin boosters. You can see you've got your temporal artery there, which is obviously one of our highest risk areas. Down here is where we can inject, so from the eyes down. But you can also see that with us doing that, we need to be mindful of certain arteries, such as our facial artery, our lateral nasal artery as well. So when you are injecting, we need to make sure that we consider anatomical differences with each client. So as I've mentioned already, with injecting, you need to make sure that you're injecting superficially. However, if you are using a cannula, you can't quite go as superficial as you would with a needle. So you do need to make sure that you feel confident with using a cannula when doing treatment. So here you can see all the different areas that we can use all the products within the youth range. So as I've mentioned, you've got your sub-Q, you've got deep, you've got fine, and you've also got your hydrate. So hydrate can be used all over the face without the forehead, so from the eyes down to the jaw. And then you can see other areas where you'd be using your deep product, where you can use your fine product, and also your sub-Q. It's important to remember, and this is one thing I forgot to mention, that when you are using skin boosters, so with our Hydrate, for example, it is a non-cross-linked product. So dermal fillers are cross-linked products. So with it being a non-cross-linked product, it basically means that it will spread. So when we inject it, we're going to be injecting it 1 centimetre apart when we're doing our grids. When we do inject it, it is going to spread along the dermis layer of the skin. So it's really important to remember that, obviously, for your facial anatomy side of things. Sorry, guys, I'm just trying to move on again to the next slide. So that actually concludes, and I feel like I've gone through that super, super fast, but that actually concludes our webinar. So we've looked at the aging process. We've looked at the reasons why we might need to use skin boosters on the area, on the face. We've looked at the benefits of using Hydrate and also the techniques that we would use. And we've also looked at the importance of understanding your anatomical differences. One thing I also do need to mention is that skin boosters, some people often have this perception that skin boosters cannot cause complications. It absolutely can. So please make sure that when you are using the skin boosters, if you are using the needle, you remain superficial. And if you are using a cannula, you can see the outline of your cannula and you are not going too deep. If you do inject too deep with the cannula, your client will be in significant pain. So just ensure that you are practicing safely and you are aware of your depth when you are injecting or using a cannula. So you can see here now that we've given you an exclusive offer for you to be able to purchase your Hydrate bundles. I won't go through it all because I know that this has been sent out to you in a lot more detail of how you can purchase the product. But the Youth brand is something that a brand that I highly recommend, and I'm extremely grateful to be working with Youth. And for me as a practitioner to take on a brand within our clinic and within our academy, I wouldn't take anything on unless I stood by it. So I think it's an amazing brand. You get, like I said, this, for example, the syringes are glass vial syringes, which are amazing. So you run less risk of cross-contamination from the plastic. You've got that it's got 18 years worth of research behind it. It's also a UK brand, and you've got your 4 different products within the brand as well. So if you have any questions, please drop them in the chat. I will stay on the line for a little bit if anybody has any questions, or if you do need to speak to me privately or whatever, that's absolutely fine. I'm sure Acre Pharmacy can give you my contact details. But I hope you've enjoyed the webinar. I feel like I've literally gone through it so quickly. It's the first time I've done it, so I hope I've done okay and you've enjoyed your evening. But I will move on to the chat now to see if you've got any questions. If there are no questions, then, oh, there's a few that's popping up. I've put a few in the Q&A. What do you recommend in? Okay, so we've got a question here from Jodie. What do you recommend? Ooh. Is someone's camera off mute? Someone's on holiday. Thank you. Sorry, guys. If you could just keep mute on for me, that would be amazing. So I'm just going to start working my way through the messages. So what do you recommend in terms of protocol? So I usually recommend that as I've mentioned already, you can use either the cannula technique or you can use the microboluses technique. I do recommend that clients have around 3 to 4 sessions, and usually I do say 4 weeks apart to allow the skin to go through its healing process. Some of you will know that the healing process can take up to 28 days for it to go through. So for my clients personally, I do give them 4 weeks in between treatments. So in a nutshell, this is just no, it's not actually injected as a BAT technique, sorry. So we've got a question asking, is it injected as the BAT technique? The BAT technique is a 10 point, sorry, so 5 on one side and 5 on the other technique. This is not the same. So this can be injected as a grid. So literally you can do small injections, similar to mesotherapy, I would say. So you can do small injections, draw a grid onto the face, and you can target specific areas. So if somebody is presenting with crepey skin on the chin area, for example, then you can target the chin area, whereas the BAT technique is only in those 5 areas. How many treatments as a start? So again, I would recommend that your clients have around 3 to 4 sessions, 4 weeks apart. Oh, the messages are coming in very thick. Then 1 second. Price per treatment. This is a really hard one. I can never really give you a price. I would usually say around about 120, 150 per session. It's a very good price bracket for youth. Like you can see here that you can get it for £20. So there is a very good price bracket. I would probably charge around about 120, but it does depend on the area that you're in and also what other treatments you currently offer. You might want to do it as a combination with other treatments as well. So around about 120. Ours is £150 a session. Would you get good results for a turkey neck? I think it would help with I wouldn't say turkey neck. So it's definitely going to help with the neck for hydration. Yes, absolutely. Depending on how dehydrated or how aged that neck is will determine how many sessions they will need. So the 3 sessions is the minimum amount of sessions I would recommend. I have given people up to 6 sessions before. So that's for like my older clients. My younger clients, I've gone more around the 3 sessions, 3 to 4. We've got another question from Marlena. Is it 2 ml syringe, 24 milligram of HA per 1 ml? So it isn't a 2 ml syringe, Marlena. It's a 1 syringe and it's 1 ml. So it's 24 milligrams per ml. So you would be using a ml per side. Dr. Trish, the average cost per client, as mentioned already, I would recommend around about 120 to 150 hours in our clinic is £150. Obviously, if you're selling a course, guys, then this is where you would change your prices and maybe do it where you're offering 3 sessions for the price of 2, something like that. Could we see the prep inside and how it comes before we purchase? That would be something to discuss with Acre Pharmacy in regards to could we see the prep inside and how it comes before we purchase. It literally does come as a pre-filled syringe, so a little bit like a box of filler. It will come with a pre-filled syringe and you'll have 2 needles that come with it, 2 30-gauge needles in order for you to inject. I'm just bringing up another one here. Okay, so we have a question. So if it's the entire face that needs the treatment minus the forehead, 1 ml per side, and just distribute the bolus equally, up to 1 ml. That is correct. Yes. So you can inject up to 1 ml per side, avoiding the forehead. So from the cheekbones down, covering the jawline. It might be that you want to go onto the neck as well. That's entirely up to you in order for you to let the product spread. But you would be using, you don't have to use a ml per side, but we do say the recommended amount is a ml per side, which is quite easily done as well if you are using a cannula. Steph, each box is 1 syringe, yes, and it's 1 ml in the box. Sorry, I think I'm coming towards the end now. I love all the questions, so this is great, guys. As I can't actually speak to you and you can't see me, it's quite nice having the questions. Rabina, so Rabina has asked, for this offer, can we buy on prescription? I'm not sure if you can answer that one, Holly, for me. I'm sure that's not a problem, but I don't know.
Yeah, I can't answer that, but I will make sure that I get an answer for you, and I'll get back to you tomorrow, Rabina, if that's okay, via email. I'll have your email address anyway, so I'll make sure I get that answered for you.
Thank you. We have a question here from Jodie. How does it compare to the likes of Profilo? So Profilo is different in regards to it's used for different things. So Profilo is a biorevitalizer product, and Youth Hydrate is a skin booster product. So it's basically there to help with hydration, hence the word hydrate. It is to help with hydration. Yes, it's going to help with fine lines and wrinkles, but its main element is hydration. Profilo is more of your anti-aging treatment, and I would probably say from personal experiences, Profilo I generally would use for an older client, and Youth I would use as like your almost preventative, I suppose. So I would use my Youth for around about 30 to around 45 years. But then my Profilo is when I would use it for my older clients, or if somebody's presenting with signs such as age spots and things like that, that's when I'd use Profilo. They are completely different. And also, if you think about the hyaluronic acid that's in both of them, you know, it's one is a little bit more than the other. And it's also delivered in a back technique, whereas this is all over the face, so it can target everywhere. Okay, I think I've gone through all the questions. Unless anybody has any more questions, please feel free. I'll stay on for another 5 to 10 minutes anyway. So please feel free to ask any questions. If you don't have any questions, you are free to go and enjoy your evening. And I just want to say a really, really big thank you to all of you who have attended. I've been so nervous about today. I literally worked myself up. So thank you so much to everyone who's attended.
Oh, hello.
Hello.
Oh, hi. Sorry, my typing chat thing won't let me ask a question.
It's okay. Go on then, darling.
Sorry. I've been using the Hydrate and I really like it, but can I use it in conjunction with the Profilo?
I would say yes. So you know when so maybe like 2 weeks after. So if you gave your Profilo, for example, and then maybe give your Hydrate 2 weeks later, and then give your Profilo again 2 weeks later, because you're only going to give 2 Profilos, aren't you?
Yeah.
And then in that time, until they have like their top up at 6 months for Profilo, that's when you can give more Hydrate.
Because that's how I've been selling it, like do the
Absolutely
Profilo,
fine.
and I'm like, in between we can just hydrate the skin, etc. So I've been doing that. When I've been listening, I was like, oh God, am I doing this? Should I have been doing that? But that's fine.
Fine. You can do it in between, because I think with Hydrate, it targets different things. Like Profilo is in specific areas that it's injected, isn't it? Whereas your Hydrate, you can target the crepey skin in areas that the Profilo isn't injected, such as, you know, the mid cheek, for example. Profilo isn't injected there, so you can target that. It might be that they've got crepey skin in the chin area. So absolutely, you can do it in between. That's not a problem.
Perfect. And I've also noticed that quite a few of my clients I've actually preferred. They said they see more difference actually with the Hydrate than they have with the Profilo.
Yeah. And I do find that it's really difficult.
It's quicker as well. I find it's a lot quicker. Like,
yes.
I trialed it with my best friend when I started using it, and she was like, literally within a week or two, she was like, I feel really glowy.
Yeah, you do feel glowy. You actually feel quite plump underneath your skin as well. So when you actually touch your skin, so I've had Hydrate before, and when you actually touch it, you can feel the cushion in your skin. So it is completely different. And some people are, you know, great for Profilo, and some people are great for Hydrate. Everybody's skin's so different, isn't it? And you know, it might work for others, I think, and it may not work for somebody else.
Yeah, so far so good.
Yeah, good. That's really good to hear. And it's nice
also
to speak
as well,
to someone.
Sorry. So would you use it kind of like how you would do like the Dilute Pro and things like that? When you were saying about the grid, kind of how you would use that?
Yes. So do you use Dilute Pro at the moment?
Yes.
Okay. So we obviously use that here as well. So how you grid your classic or your HMW, you can do the same with your youth.
Perfect. Okay, well, nice to know I've been doing it okay.
You've been doing it brilliant. Well done.
Okay, sorry to come on verbally, but it just wasn't letting me write a message.
No, it's fine. Honestly, don't worry. It's nice to have a conversation. It's fine. Don't worry.
Oh, thank you so much. It's very insightful. Thank you.
Take care.
Bye-bye. Thank you.
Looks like we've got a few more questions. Can we print the manuals used in this webinar, please? I believe it's going to be sent to you in an email. So I think you're going to get this whole PowerPoint. So I can't see a problem with you printing it out. That should be fine. Oh, Steph, yes. So I did forget to mention this. So I do use the Fine product for Russian lips. So the Fine is used for Russian lips or for natural lips or a nice natural lip contour, your very, very fine lines, and then your deep would be used for like your classic lip technique or your deep line. So yes, if you are doing Russian lips, I would recommend the fine product. However, if your client is having Russian lips and they've got quite a lot of skin, so for example, if they've had dissolving done before, sometimes they can be left with stretchy lips. You may need to use the deep just to fill it out and pack the area a little bit more. But that's a whole nother topic. But I can absolutely, yes, you can use your fine. And if you need any more information on that, just drop me a message. Okay, I think I have covered them all. Any more? No.
Is there any reason you can't inject the forehead, please?
Oh, where's that come from, Ali? So the reason why we've said not to inject the forehead, this is entirely up to you as a practitioner and you knowing your competency. So just making sure you are aware of anatomical differences and variations with your clients, knowing your high risk areas. I don't know if you was here for the high risk area part, but it's mainly to do with, obviously there's blood vessels up above. We are still using, it is a dermal filler product, so it's still a gel consistency, and we obviously have some high risk areas there, such as the temporal area, your supratrochlear and supraorbital arteries as well. So it's just being mindful of the anatomy and the forehead. Does that answer your question, Ali?
Thank you.
Yeah. Anyone else? Feel free to speak to me if you want to, rather than write it in a chat. No.
I think we might have wrapped up there. Got a couple of people leaving now.
Fab, okay. Lovely. Well, for those of you who are still here, thank you so much for joining us this evening, and I hope you have a lovely evening, and I do hope it was informative for you. But like I said earlier, this presentation will be sent to you from Acre Pharmacy, and if you have any questions, please get in contact with Acre, or you can get in contact with myself at SK Aesthetics.
Perfect. Thank you, Sabrina.
Thank you. Bye-bye.
Bye.